Well, it's time now for perspective. These past months, we've all become very well acquainted with COVID-19 lockdowns and restrictions, but not all lockdowns are created equal. My guest today is France Télévisions reporter Arnauld Miguet, the only French journalist to cover the entirety of the lockdown in the Chinese city of Wuhan, the epicenter of the global pandemic. He's recently published a book recounting his extraordinary experience called 133 jours à Wuhan, or 133 days in Wuhan in English. Thank you very much for speaking to us here on France 24 today. Now, Wuhan did go into an extremely strict lockdown on the 23rd of January last year, and you were there to witness it. How did you come to be in Wuhan at the time?
Well, I was trying to do my job, and we knew that something was happening there. At the time when we took the plane on the 22nd of January, there were about 550 cases of an unknown mysterious virus. We didn't know, it didn't have a name, the name of COVID-19 yet. There were 70 people who died from it, officially, of course. So we decided to go. And as soon as we arrived, we started to do some reporting. And then we heard on the night, between the 22nd and 23rd, that on the 23rd of January at 10 o'clock in the morning, we won't be able to leave Wuhan. Nobody could, and nobody could come to Wuhan. And we decided to stay to see how things were unfolding. And we stayed for 133 days.
And what were those initial hours, those initial days of lockdown like in Wuhan?
Oh, it was terrifying. It was science fiction. You could hear the birds. Nothing was moving. Everything was on a standstill because the way the Chinese authorities handled it is very strict. No transport, no cars. People have to stay at home. They could go for every 3 days to go and buy groceries. All the shops were closed except supermarket and pharmacies, and of course hospitals. But there was no traffic, there was nothing. It was absolutely incredible. For a city, a Chinese city of 11 million inhabitants, it was absolutely surreal. And from the mid-February, the lockdown and the confinement was even stricter. People could not leave their home. And in big buildings, there was no lift during the day, so that people didn't have the temptation to go elsewhere and had to stay indoors. And the food was brought to them by the committee of quartier, neighborhood watch, people working in the neighborhood. The food was brought to the people in front of their apartment. It was a very, very strict thing.
And what was that like for you psychologically? Because, of course, at the time, you had no idea how long those restrictions would last for. And, of course, 133 days isn't nothing.
No, you didn't have any horizon. The authorities would not communicate as to when it would end, and we would see the fever growing in the city, the number of cases growing every day. So it was quite scary. But the troubling thing was that we didn't know when it would end, and we never thought that the blocus of the city, the fact that you couldn't leave the city, would last for 76 days, which was long enough. So it was. But on the other hand, we had a job to do, so we were occupied compared to the inhabitants of Wuhan, who had really to stay indoors, doing nothing, and without having an horizon either. But for us, it was easier because we had a job to do. We could go outside. We could go take a car and go and meet people in hospitals or in grocery shops or volunteers or members of the French community. So in a way, it was easier.
And what was it like working during that period? What sort of restrictions did you encounter in your day-to-day reporting on the situation?
Well, it was quite surreal. It was quite surreal because we had to say where we were going. we didn't have to say how we were going, how would, by what means we would travel. So a lot of, most of the time I would say, okay, we're going to the French consulate, we're going to see the authorities because it was about 30-minute walking distance from our hotel. And then we would walk a little bit and take an arranged car to travel in the city. But in a way, the authorities knew what we were doing. And there is always surveillance in China, but they in a way let us do our job, and it was quite surreal because I've been in China for more than 4 years, and we asked many times to be able to go and film in a hospital for whatever reason, but in Wuhan, and of course, usually it's turned down. And in Wuhan, we were able to manage to go inside the hospital and report on the real first serious cases of COVID-19. So we could work, which was, I could not have stayed in one room stuck for that long. So that was a very strange period, a very surreal, very bleak winter in Wuhan. But we suffered less than the inhabitants of Wuhan who were stuck indoors.
And across the world in recent months, there has been a fierce debate over how to balance strict health measures with personal freedoms. China right now has all but eradicated the virus. I think there were 7 reported cases of the virus in China on Thursday. Is that proof that the Chinese approach worked, that extremely strict lockdown?
Well, I guess it worked. I mean, the lockdown in China was not a national lockdown. It was in Wuhan, in some cities, in some neighborhood. And as soon as there are 10, 20 cases, the whole city is in a lockdown. So there were Wuhan and mini Wuhan thereafter. That's the way it works, very draconian. The Chinese authorities don't put gloves, and people usually obey to the rules, and they have to obey because there is human surveillance and technological surveillance, and they know that they have to abide by the rule. But it's China, but it's Asia. Don't forget that in other places in Asia, or even in Australia, for instance, there's been strict lockdowns as well, and it seemed to have paid off. The lockdown is not the panacea, of course. It's also the frontiers being shut, people not being able to come to the country. They can leave the country, but they can't come. That's the case in China. That was the case in Taiwan, who start and ban people from arriving in Taiwan if they are not resident. It's the case in Australia, it's the case of New Zealand, the case of Vietnam, the case of Thailand. So it's not only so-called authoritarian regimes who adopted this measure, but the philosophy in Asia mostly is to have zero COVID. And as soon as there are cases, well, the measures are being taken to stop the chain of contamination in order to be able to start again. And that's certainly what happened in China. Of course, despite individual liberties and
Miguet,
freedom.
I'm so sorry. I'm sure you're used
of...
to this yourself. We have run out of time. I do apologise. Thank you so much for sharing your experiences with us today on France 24. Arnauld Miguet, author of 133 Days in Wuhan.